Hello and welcome, and today we're going to be talking about knee ligament injuries. So let's start with the knee. At the top we have the femur. Down below we have the tibia and the fibula. Together they make up the knee joint. So the knee allows for flexion movements and also extension movements. Now the knee is supported by four major ligaments. So on the outside we have the lateral collateral ligament. We also have the medial collateral ligament, which is on the inside, and then in between the knee joint we have two major ligaments called the ACL and the PCL. They make a cross, okay? So the ACL stops anterior slippage, the lateral collateral ligament stops lateral or outside slippage, the medial collateral stops medial or inside slippage, and then the PCL stops knee posterior or backward slippage, okay? Now, when you're walking, running, cycling, jumping, these ligaments, they're under stress. Okay, part of movement, a consequence is injury. So if we have too much movement or if we have abnormal movement, then these ligaments are prone to injury. When we get injury in these ligaments, we generally classify it into three stages. So there's grade 1, which is a minor tear, grade 2, which is a moderate tear, or grade 3, which is a severe or complete tear. Now, if you have a lower grade tear, let's say grade 1, we would expect less treatment and less rehabilitation than if you were to have a higher grade tear like a grade 3, and vice versa. If you have a grade 3 tear, right, you're looking at longer treatment, longer rehabilitation. Okay, let's start with minor. So if it is a minor tear, you'll notice that you'll lose a lot of the movement in your knee. You might not be able to get full flexion, and you might not be able to get full extension. So one of the first things you want to look at is mobilization to try and get that to move again, back to normal standards. The other thing that you'll notice is a ton of swelling. So one of the things we want to do is swelling's great for the body, but we want to help move it along. So a lot of elevation in the early stages, and then a lot of physical therapeutics. We're looking at heat and ice to help move that inflammation along, okay? After we progress down that stage, what you want to look at are things like rehabilitation, because the muscles around it, they start to go weak, they start to go tight. We want to use exercises and specific mobilizations to help all this strengthen for a speedy recovery. If you get something that's a grade 3 or a high grade 2, that's when you're looking at surgical options. Now, if you have to go down that path, it's best to speak to your surgeon about it, but there's one thing you want to keep in mind: the pre-surgery phase. So that's where you want to start doing exercises before to really strengthen up that joint, really get it moving before you go into surgery, and that allows for a better recovery. Okay? Now, this was just a quick recap about knee ligament injuries. We also talked about the anatomy of the knee, how it works, why it works. If you have any more questions, click the button below.